Hello, thank you for joining us today. My name is Kelly Fountain, and I'm joined today by Jessica Elliott. And today we're going to be covering QPP, or the Quality Payment Program Year 7 or 2023. Now, before we actually get started with the content, let me draw your attention to our disclaimer. The information contained in this presentation is for general information purposes only. And while we endeavor to keep everything up to date and correct, we can make no representations or warranties of any kind expressed or implied about the completeness, accuracy, reliability, suitability, or availability with respect to content. Now, as a reminder, my name is Kelly Fountain, and today I am joined by Jessica Elliott, and we are going to be covering Year 7 of the Quality Payment Program Final Rule. So, on November 1st of 2022, CMS released the final rule. This final rule is going to impact a whole host of different programs. But in today's short little video, we are actually going to cover the impact to the Quality Payment Program. We provide the different relevant citations and the links to the fact sheets as well as the actual final rule. Just to kind of recap, CMS did not make any dramatic changes to the minimum threshold to avoid penalty. This, of course, is a budget neutral program now, meaning there's no set side of money or kind of bonus, if you will. So the losers do fund the winners. So you have to get at least 75 points or higher to avoid that negative 9% penalty. Now, of course, the CMS does use a sliding scale, but ultimately you do want to ensure that you at least score 75 points or higher to make sure that you avoid that negative 9%. In addition to that, CMS did go ahead and reiterate that the measures or the different categories carry the weights of 30 for quality, 30 for cost, promoting interoperability carries 25%, and improvement activities carry 15% for traditional MIPS in particular.
Now I'm going to talk with you a little bit about some of the important updates to keep in mind for going into effect in 2023 as well as into 2024. So as always, CMS does reserve the right to adjust measures, to remove and add measures. And so always go back and look at the measure specification sheets, look at your workflows at the beginning of each year to make sure that you're reporting your measures accurately and correctly to meet those specifications. Something else that I do want to call your attention to are some of the removed measures for traditional MIPS that I think might be particularly impactful. Influenza immunization, as well as pneumococcal vaccination. Those are very highly commonly reported measures, especially here in the state of Kentucky. And so those measures are no longer going to be available for you as a practice to be able to submit via traditional MIPS. What makes this is a little different is that, because we're used to them removing measures. However, they are retaining these two measures for the MIPS value pathway if that particular pathway already has those defined in there. So that's just something to consider as well with that. Another element that I think is really important is data completeness. Now, they are maintaining data completeness at 70% for 2023, but they have already finalized that it is going to increase in 2024 and 2025 to that 75%. So again, that's about the total population, the reporting in the full calendar year, making sure that you are providing at least 70 or 75%, depending on the year of your population whenever you're reporting your data. Again, now this isn't anything that is new. This was actually finalized in a previous rule, but we did want to make sure to refresh everyone on some of the scoring changes around the benchmarks. And so if you're a large practice, meaning that you have 16 or more eligible clinicians tied to your tax ID, this will be particularly impactful to you. Measures are now not going to have that 3-point floor. So you can now earn anywhere between 1 and 10 points for your measure. So that's going to further impact your potential points around that performance category. Same thing with measures without a benchmark. You wouldn't receive any points for those or measures that don't meet case minimums. Now, if you're a small practice, though, they did afford some flexibility so that 3-point threshold, and that 3.4 still remains for small practices moving forward in 2023. One other quick thing to call out is just to make sure that your EHR, your CERT, is up to that 2015 edition cures update. And that needs to be in place at the start of the performance period for quality. And of course, we know that that starts on January 1st of 2023. Now, to transition over to the promoting interoperability performance category, there have been several updates to this particular category. The first one is removal of the querying of the prescription drug monitoring program as a bonus and having it be a point value that's a part of that overall objective. So the 10-point bonus will now be 10 points that you would then be required to earn for that category by an attestation of participation in that querying. Right now, they are not requiring a numerator or denominator performance. They've also added an additional way that you can meet the health information exchange measure. So the two options that we've traditionally, or we've more recently, I should say, had, but then they've added a third one. It's participation in TEFCA. And this particular agreement is something that would be through your EHR vendor to meet certain standards and specifications moving forward as related to, and programming standards, I should say, as related to providing that bidirectional connectivity and exchange on a larger scale. No changes to the provider to patient exchange category around that particular measure, but something I did want to call out around public health and clinical data exchange. So we've historically been able to stay in that participation agreement level with our registries and with public health reporting. However, CMS is now condensing that time frame, and starting in 2024, you can only be in the participation agreement and the testing and validation phase for 1 year. And then you have to transition into that full live functionality phase. So we're going from 3 options and 3 phases down to 2 phases and a time frame on how long you can be in that agreement and testing phase. Now, again, that starts in 2024. So we do have a little bit of time to get everyone transitioned over to be able to report immunization and e-case reporting. They did retain the 5-point bonus, though. That is the only bonus opportunity that you do have for the promoting interoperability category if you have one of those other type of registries, such as public health, clinical data, or syndromic surveillance.
So along those lines, improvement activities, there were only a few updates that CMS actually finalized and made to this category. The first in particular is actually around the consultation of prescription drug monitoring program. Because CMS finalized that as a required measure under promoting interoperability, they actually removed it as an improvement activity under this performance category because it's duplicative. In addition to that, CMS also removed a handful of other measures, 6 in total. They also added 4 new measures in total and modified 5 existing measures in total. Now, cost in particular is another performance category that CMS made minor changes to for the 2023 program year. The first, though, that perhaps is one that is perhaps raises some questions is the improvement scoring. And the reason it raises questions is because you will not see an improvement score for 2023. And you can get up to 1 percentage point out of a possible 100 points, right? But you have to actually be evaluated on cost more than 2 years, or at least 2 years, I should say. We haven't actually seen anybody be evaluated on costs because it's been waived for a couple of years due to COVID-19 or other circumstances associated with the performance category. So we won't see this improvement score actually come into play probably until 2024, but that is a new option that we can see as kind of a bonus point, if you will, in the future for this performance category.
Now I want to pivot and talk a little bit about MIPS value pathways. So MIPS value pathways, it launches here in just a few weeks in 2023. And so you will have voluntary reporting. So you can still report traditional MIPS actually up through 2026. So you can do traditional MIPS and you can do MVPs. You can but we do anticipate that after the 2026 performance year, that MVPs and APMs will be the primary direction for this program. They have not officially finalized that yet, but that's where things are trending. One thing to also consider is the different ways in which you can participate in MVP. So you can participate at that individual clinician level. Right now, we do have the functionality for multi-specialty group reporting. That is actually going to transition away through 2025. That'll be your final year. So starting in 2026, you'll have to either be as an individual single specialty, or you'll have to form subgroups within your tax ID to be able to participate in a MIPS value pathway. And this is all designed to ensure that clinicians are monitoring and attesting to measures that are meaningful to their own individual scope of practice or the type of patients that they provide care to. Some other things to consider are the timelines for this implementation and the registration period. So starting on April 1st of 2023, the options to elect your MIPS value pathways will open. That timeframe will last until November 30th. So you can go in and you can select the particular measures that you need. You'll identify those clinicians who are tied to your group or to your subgroup, and you'll be able to go and make changes within that system through November 30th. CMS has also afforded a little bit of flexibility as well, too, so that if you're reporting traditional MIPS as well as MVPs, they will actually consider for 2023 the higher of the two scores if you participate in both. So there's that to encourage practices to start exploring and looking at how they would break out either into subgroups or just what MVPs would align with the current work that they provide. Just another caveat, if you do have caps for MIPS measures that are a part of your MVP pathway, you do have to have that signed up and participate in that process per the normal timeline of June 30th of the current performance year.
So CMS actually finalized additional measures or MVPs. So we have 12 MVPs at this point in time. So they made modifications to the previously finalized MVPs, allowing you essentially 12 different ones to select from for this year and moving forward. So as Jessica just mentioned, you can actually elect to participate in one of these as early as 2023. You can elect to participate in one at the individual level or at a subgroup level, and you can also participate in traditional MIPS as well. A couple of things we wanted to draw your attention to in this slide is that you're still participating in all of the different categories. This is just the lens in which you are participating in this program. You're still participating in promoting interoperability, quality improvement activities, and cost. It's really just helping you narrow your focus in so you can really kind of maximize your performance in this program.
Thank you all so much for joining us today on this discussion around some of the different important things to know about the 2023 final rule. If you do have any questions, please feel free to reach out to your Kentucky REC advisor. You can also contact us directly through any of those channels listed on this slide. And additionally, if you are playing along with us as a part of the conference, your magical little fun letter for this particular presentation is the letter E. So again, thank you all so much for your time in joining us today.